we see that there is a more of an oblique line, and she wanted more of a contour, so something like that. So how do we achieve that? So I want to share with you my process that I go through when I contour a neck. This patient here, we have a before picture on the left and an after picture on the right. I want to show you how I got to her after. She had a chin implant and a neck contouring procedure, and I'll show you how I did it. So when we look at the before photo, and we look at a chin itself, I see that it's pretty small. She does not have any changes in her bite, so she can chew really well. It's just that her chin is just a little bit more further back. So when we look at a chin placement, we look at the top of the lip, draw a line all the way down at this angle, okay? And this black area is potentially where there actually should be some soft tissue. That chin should go up to that line in the female. This can all be done with a small incision in this particular area. But also looking at her neck itself, we see that there is a more of an oblique line, and she wanted more of a contour, so something like that. So how do we achieve that? Also through that very small incision. So we look at the different layers of the neck. So in yellow, we have a thin layer of fat called the preplatysmal fat. And then I'm going to change this to red to show the platysma muscle, which is a very small and thin muscle, but it oftentimes becomes redundant. And so by bringing that together, we can lift up the neck. But also importantly, there's a deep layer of fat called the deep fat that is genetic in nature, that no matter how much diet or exercise you do, it's very difficult to get this fat treated. So if you were just to do a common procedure called liposuction, you'd be only treating this small, thin layer of fat. With her, we really need to get the platysma muscle and as well as treat the deep fat, okay, in that particular area. And all through getting a small incision right underneath her chin. So with her after, we see that she has nice projection, that's this arrow going in this direction. She also has projection down in this area, and we have a nice contour underneath compared to this kind of oblique line in this area. So when you look at her after as well, there's a nice balance to her face, and this is all done through a small incision by increasing the projection with the chin implant right on her bone and increasing her contouring by removing different layers of her anatomy and bringing those together.